Welcome to another video lecture on structural activity relationship of barbiturates, an example of our central nervous system depressant. The pharmacophoric structure of barbiturates originated and derived from barbituric acid, or the malonylurea. Malonylurea is a combination of urea and malonic acid. Please refer to the structure presented in the slide. The structure-activity relationship of our barbiturates depends on barbituric acid, but barbituric acid is also called 2,4,6-trioxohexahydropyrimidine, still lacks central nervous system depressant activity. However, if we will replace portions on our barbituric acid, it can create the general structure of the barbiturates. Replacement of both hydrogens at position 5 with alkyl or aryl confers the activity. Both hydrogen atoms at the 5 position of the barbituric acid must be replaced. Consequently, the compound is largely in the anionic form at physiological pH, with little non-ionic lipid-soluble compound available to cross the blood-brain barrier. So when we increase the lipophilicity, that allows increase the rate of metabolism, except for compounds with an extremely high lipophilicity, which is thiopental. Increased lipophilicity also increases hypnotic potency and the onset of action. Therefore, it can also cause decreased duration of action of the drug. The metabolism generally follows an ultimate or penultimate oxidation pattern. N-methylation decreases duration of action by increasing the concentration of the lipid-soluble free barbituric acid. Modifying the structure of the hypnotically inactive barbituric acid can convert it into a hypnotic barbiturate with physicochemical properties that affect its ability to gain access to its sites of action and to interact with its receptor. Hypnotic activity is introduced into the barbituric acid by the addition of side chains, especially if at least one of them is branched as mentioned in the previous slide in position 5. Quaternary carbon at position 5 is also necessary for activity. Unsubstituted compound is more acidic than disubstituted derivatives, hence it does not depress CNS. An ionized drug can penetrate the membrane. Introduction of one alkyl or an aryl, an aromatic group, at position 5 has little effect on acidity, whereas two groups decrease the acidity. Also, when the sum of the C atoms at position 5 is larger than 7 or 8, activity drops. For example, your dibenzyl barbituric acid, it produces no effect at all. Introduction of a polar functional group such as ether, keto, hydroxyl, amino, and carboxyl on the side chain usually destroys the depressant effect. The length of the side chains in the 5 position influences both the potency and the duration of action of the barbituric acid. Acecobarbital and thiamylal are slightly more potent than pentobarbital and thiopental respectively, because the former drugs have slightly longer side chains in position 5. Replacing also the oxygen atom with sulfur at the position 2 of an active barbiturate produces a barbiturate with more rapid onset and a shorter duration of action. The thiobarbiturates, thiopental, and thiamylal have faster onsets and shorter durations of action than other oxybarbiturate analogs, pentobarbital and secobarbital. Methylation of an active barbiturate in position 1 produces a drug such as methohexital. with not only a rapid onset and short duration of action, but also an increased incidence of excitatory side effects. Therefore, any chemical modification that increases the lipophilicity of a hypnotic barbiturate generally increases both its potency and its rate of onset, while shortening its duration of action. Now, for your activity on this section, please look for examples of drugs or barbiturate drugs and indicate their different duration of action, citing their substituents in R5, R5 prime, and R1, which provides them different levels of lipophilicity and different duration of action. Thank you so much for listening.